Welcome everybody, welcome everybody. I see we have quite a good number on board. We'll be starting in exactly 30 seconds. All right, welcome everyone. I see we have over 100 participants already in just 2 minutes into the webinar. Thank you everybody for making time to join this webinar this evening, hosted by the Kenya Medical Association, the Physician Wellbeing Committee. My name is Dr. Melanie Murgor. I am the convener for this committee, and I'm very excited to have you all on board this evening. Today is a very important day, not only in our country, but globally. It is the World Mental Health Day globally, and in our country, we're also commemorating the Utamaduni Day. The theme for this year's day is on make mental health and well-being a global priority for all. But for the specifics of the webinar, we are going to tweak it a little bit to look into the well-being of doctors. This evening, we have exciting panelists lined up to discuss this. But more importantly, I'll tell you a little bit about the Kenya Medical Association Physician Wellbeing Committee. While doctors and healthcare professionals are affected by mental health issues like the general population, it is well known that we are more than 2 times at risk than the general population. Hence, there is a need for us to even pay 2 times more attention towards our mental health and our well-being. This physician well-being committee that is taking over from the previous one, who has done a really good job during the pandemic period, we are coming in at the transition towards the post-pandemic period, where we experienced really issues of great concerns on human resources for health. We looked at safety issues for physicians, and at this point, we can only tighten the efforts to improve the well-being and safety and mental health of physicians. Further to that, 3 days ago, we had a really interesting address by the World Medical Association new president, Dr. Osahon, who called on countries to pay more attention to the physician well-being, to look at their safety of their workplaces and their environment. And the reason for this is because of the rising concern of physician burnout, not only in Africa, but globally. It is for this reason that this webinar is very important for each one of us to listen in and to take key points that we can take into consideration. Towards the end of this webinar, we'll be telling you a little bit more on the activities that the KMA Physician Wellbeing is going to undertake over the next 2 years, and we'll be welcoming you to join all the committees in Kenya Medical Association so that we can continue to work together. I'm not going to take much more time on this introduction. I will hand over to our moderator for the evening, Dr. Florence Jaguga, who will introduce herself, and she will also introduce to us the panel for the evening. Karibu Daktari.
Thank you so much, Dr. Melanie, and thank you so much to our colleagues and everyone else who has joined us today. Today is 10th of October. We commemorate World Mental Health Day. And the theme for today, as Melanie said, is to make mental health a priority. And for today's webinar, we're going to be focusing on making mental health a priority for doctors as well. And this is an extremely important webinar, one, because doctors are human beings, so their mental health needs to be prioritized, just like it's being done for the rest of the public. But secondly, it's also because doctors are a very critical resource. They offer a very critical service that's very important to the society. So they need to be well, they need to be whole and healthy so that they're offering this very important service. If you have an impaired physician, if you have an impaired healthcare provider, an impaired doctor, and then compared against a very limited human resource in a country like Kenya, then we are saying that service delivery then is going to be interfered with. So I think today we'll be discussing about how to make the mental health of doctors something that's important, something that needs to be prioritized. And here with us today is Dr. Koba, who is a psychiatrist at Moi Teaching and Referral Hospital and head of department there. She's also the Kenya Psychiatric Association CPD coordinator, a committee member of the Kenya Medical Association Physician Wellness Committee. So karibu Dr. Edith to take us through what it means to make mental health for doctors a priority.
Thank you very much, Dr. Florence. Thank you, Dr. Melanie. Thank you, everyone, for joining us this evening. I hope you can see my presentation. I'm really excited to be here this evening because for a long time, and in many parts of the country today, people are talking about mental health, but they are focusing on the community, the general community. And for a long time, we forget that the doctor is a human being. And today, we may not talk a lot of science about mental health. We just want you to sit and reflect about your own mental wellness. You've thought about many things in healthcare that relate to other people. But today is an opportunity for all of us to think about how we are doing as a team. Because if we don't take care of our wellness, nobody will. And people are very busy. I'm sure many of us would have got to a point where you are even unwell, but you're called by the hospital because you know you're very important. And even if you're unwell on sick off, you should still give some input. Or your patient felt very bad that you're not able to come to work because you are unwell. And we keep forgetting that as physicians, as doctors, we are human as they come. And as we take care of other people, and for us to take good care of other people, we must be well, as Dr. Florence has said. So World Mental Health Day has been observed for a long time, and we again remind ourselves what the theme is, that we want to make it a priority. Why are we calling upon ourselves to make it a priority? Of course, it's because we have prioritized other things. We've prioritized our physical well-being, we have prioritized our social life and other aspects of life. And we forget that that there's no health without mental health. And for that reason, many people continue to struggle and suffer. Many of you would know and would have read by now that the treatment gap for mental illness remains very high. True for the general population. If you look at World Health Organization facts, about 75% of the general population don't have access they need. Those who are suffering from mental health issues, probably worse for doctors because of many reasons why we don't seek care. And I'm sure you would have read by now what mental health is, and we have to keep reminding ourselves that we are not talking about that person who is very confused walking on the street. We are talking about you and how you feel about yourself, that if it's not positive, just maybe you're not well. We're also talking about how you feel about your own worth. Do you believe that you're worth anything? Do you feel like you have dignity? Do you even believe other people deserve to be treated with dignity? Life brings a lot of stressors. Are you able to manage the stressors, including the current cost of fuel, the current cost of goods in the supermarket, the joblessness that we have encountered as doctors? These are life challenges that probably we were not prepared for a long time, but we have to handle them. And a person who is mentally healthy is able to adjust and accommodate the new circumstances and take risks. For a long time, again, we were very comfortable. And we knew if you graduated as a doctor, you will be hired. Are you now able to take a new risk and say, I may not be hired in a hospital, for example, but I'm going to take risk in a business? Or are you afraid that it will not work well? Again, very simple concepts that redefine mental health. How are your relationships? Again, as you sit tonight, I want you to challenge yourself and check. Are you doing well in terms of your relationship with peers, your relationship with family members, your relationship with your boss? All those things actually go to define mental wellness. And it's sometimes we get lost in thinking about depression, about schizophrenia, and the complex aspects of mental illness. But truly, there are many people who are struggling, even when they do not fulfill the criteria for DSM-5, or like schizophrenia or other major, what we describe as major mental health issues. So just looking at this, please sit down and ask yourself, how do you feel about yourself? How are you managing your risk? How are you managing the challenges that are coming? Because if these are areas you're struggling with, probably you may need help. And I'm sure that you know that by now that there are very many types of problems, mental health problems, and we can go into the details of how do you define mental health problems. We don't have the opportunity to do that in 30 minutes, but there are many, from depression, schizophrenia, eating, sexual disorders, and we can't go into the details of how big the problem is. And Melanie started us off by saying that as doctors, we are actually at risk. And if you just think about suicide, people who have died of suicide, who are doctors, especially because this is what in our lips right now, because of colleagues we have lost in the last few weeks, again, we are twice as much likely to kill ourselves compared to the general population. And then COVID happened, and we all know about COVID and what it did to us. We who are called the front soldiers without enough protection, people who lost jobs, all those things that happened during COVID-19 actually increased the risk. And we don't have all the time to go through the burden in terms of prevalence, but I was just interested in sharing this one, the one on during the meta-analysis that was done during the COVID-19 season. And you can see almost 50% of us suffered from post-traumatic stress disorder. Look at, again, 40% of us were depressed at some point. And this is a meta-analysis that was done just very recently. Of course, this was worsened by the situation of COVID-19, but the truth is, and that's what says this writer of The Wicked Problem of Physician Wellbeing says, that doctors have suffered for a long time from various mental illness and especially burnout as one of the common challenges. We have struggled with these problems. The burden is there, and you can continue reading. And if you just Google right now, I just put the Google and said doctors who died of suicide in Kenya, and you can see there are many images that would come, or people who we have known, our sisters, our brothers, our colleagues, and this list is not exhaustive. And this is the truth. What you find on Google is probably the tip of the iceberg. There are many people who have died, people who have had sudden death. And I listened the other day to an official from KMP, the KMPDU talk, and they say for many of us we'll be told it's sudden death. But for many family members, they would know that something unusual happened to that colleague of ours. People who have died of liver failure because of alcohol use, people who have suffered even myocardial infarction from chronic alcohol use or other issues. There are many. And we probably, if we were to get a list, there would be many and depressing. So it is true that we are not okay as doctors. And this was a study that we did during the episode, the season of COVID-19. And you've seen, I've highlighted the harmful alcohol use, a pet topic for Dr. Florence Jaguga here. We are drinking. And even if we know that alcohol is harmful, we are continuously killing ourselves slowly but surely. And the question is, could this be our way of coping with the difficulties we are going through? Why is it that NACADA would say the prevalence of alcohol use disorder, for example, in the general population would be maybe about 16%, and as doctors, we are at 40%? Exactly what is happening? Probably many things are going on. And unfortunately, most of these are not being addressed. And if you are interested in following up that work, we managed to publish the work that we did during that season. Dr. Florence also published the one on harmful alcohol use, so that we have reference. And the question we are asking ourselves is, why are we dying of suicide? Why are we drinking alcohol so much? Why is it that we are suffering quietly and we are not able to seek help? And the first most important thing I want to remind all of us is that you and I are human beings. Before you even come to the hospital with all these stressors, we are human beings. First, we come from backgrounds that some have challenges. We grew up with mothers and fathers and sisters and brothers, and there could have been issues that predisposed us to having mental illness. There is the social media with all its complications. You have had a classmate for the longest time. You seem to have been moving parallel in terms of your achievement, but suddenly they are building a lot of flats and they are making progress. They are getting promotions. They are being recognized. You know, those things that the ones that we see, like the Githeri man, they're getting recognitions you are not getting. And you know, social media has a way of making us know what is not happening to us and making us feel worse. We have lost relatives to accidents. There's all this insecurity crisis that has affected us as human beings. And that is the first reason why doctors are affected, because they are human. They are living in a society that has its own challenges. They are human beings who grew up with difficult circumstances. They are human beings who are also going through conflicting relationships. And you just need to get to our social media platforms to know what is happening in terms of our relationships, a lot of divorce, a lot of conflicts, a lot of domestic violence, and we are not spared as doctors. So the first reason why we are affected and why we must prioritize our mental health is just for being human. And then there's us as workers, and we are working in an environment that we all know very well, that we hardly talk about. You know, when you sit with psychologists, for example, you will know that they have things they call supervision. And they sit down and they talk about the cases, the clients that they serve, the difficult cases, and they are allowed to express their pain. They go through the supervision, some forms of debriefing. How many doctors who are sitting here today have had an opportunity to talk about the pain that they went through when they watched that child die, when they did a cesarean section and the mother never woke up, when there was a mass accident and they just certified 10 bodies dead? Who listens to the doctor? And that is one of the reasons why, in addition to the things that we showed earlier that are really challenging us in the society, then there's all this stuff that is happening to us. And one of the things that is happening to us a lot, and we say it, mental health is not just about the absence of schizophrenia or depression, but there are other disorders that we are struggling with. And one of the commonest disorders actually is burnout. If you go through literature, you will find that 80 to 90% of the doctors, of the physicians in the world actually have experienced some form of burnout at some point in their life. And they feel tired, they feel overwhelmed. And unfortunately, I want to believe that that's why we are getting negative coping strategies like taking alcohol, because it doesn't seem to be coming to an end. And one of the sad things is that unfortunately, and very unfortunately, people don't just wake up and collapse. People don't wake up and die of liver failure after taking alcohol. It takes time. And the question is, are you actually able to recognize that you're fatigued because of the things that you're having in your life, how your lifestyle is? There are many factors that could contribute to this burnout. But as doctors, because we have been taught to be helpers, not to be helpless, we don't acknowledge them. You can be very fatigued, you receive a call, you wash your face and you rush. And you most of the time have no opportunity, or we are not even trained to say, I feel tired today, and let so and so do that work for me right now. And what we want to remind us as doctors is, for those of us who are collapsing or who have already collapsed, most of the time, there are signs and symptoms. It's a slow fade. There are few people who will wake up, for example, if you're thinking about suicide, who will wake up and just kill themselves. There are few people who do that from impulse, but many of us will have gone through stuff, but we either never noticed or other people never noticed, and we die a slow death. And what we want to encourage ourselves in the context of making mental health our priority is to look at the environment around us. And because work, we spend a lot of time at work, we need to identify factors in work that are killing us. And this is very important, especially for us as individuals, but even for those people who are supervisors. People are burning out and feeling frustrated. Why? Because they feel like they are helpless. They are not in charge of the work that they are doing. There are some of us, especially who are supervisors and don't care about the working schedules, and you want people to keep working, and they continue working. There's no, especially it's worse because, for nurses and other cadres, they know 40 hours. But for doctors, is there an opportunity for us to say how many hours we work? We work until there's no more work to be done. That is very unfortunate. The other thing is some people are working very, very hard, but unfortunately, they only receive scolding for things that go wrong, for the minutes that were never put out on time, and they are never rewarded for good work. The other important thing is the other thing that is causing us to die, because we are dying slowly, is in our jobs, when it is not clear what you are expected to do. You could have been hired as a medical officer, but you're also meant to chair meetings. You're also meant to sit in several committees, and there's a lot of demands on you without the recognition of the fact that you're human and you need to rest. The other thing that can also cause people to burn out is when work is not challenging or monotonous, and you feel disillusioned because you have, and this happens a lot, especially when you have trained, but you go to a facility which has no equipment, and all you're doing is probably prescribing paracetamol and amoxicillin, and you wonder then, why did you have to go through medical school to study all these things? And of course, not being able to see results of work. Sometimes you keep working, and there are many people who are dying either because of factors that are within your control or not within your control. Very, very important for us to keep recognizing some of these things, because if you are going to make mental health a priority, each one of us has a workstation. They're going to look and see, are there things that are contributing? And of course, when you're working in a chaotic environment, I've had many people, especially who are working in the accident and emergency department, where there's really no rest. Before you finish this accident, another accident has happened, another emergency has happened, and there's a lot of pressure. And outcomes will not be very good. People who are working in CCUs or ICUs, Again, very, very important for you to ask yourself, what are these work-related issues that are contributing to your demise slowly? The other thing is lifestyle. As doctors, and probably alluded to earlier, is that we work until there's no work, until you collapse, which is very unfortunate. And we are working, and one of the biggest enemy of ourselves is the private practice for many of us. Why? Because you work in the public service, then you will leave and you go to the private service, and because they are private patients and they need to be made happy, you keep going, and they can call you at midnight. So even after you have left the hospital, you go, even when you're at home, you're still working, you're still being consulted, and very, very unfortunate, you hardly have any time to relax. You're working on Sunday, you're working on Christmas Day, even including today. All of us on this day, many of us would have been working either out of choice or out of demand. But the truth is, we are some of the cadres who don't have free time, as it were, and we are making it worse because we are, I call it chasing the, I don't know whether it's a Kenyan dream. It's many people refer to the American dream, because we also are competing with colleagues, and so we have to keep working, make sure you get the best car, make sure you have all the flats. But for some of us, we are also struggling with the loopholes in the family. There were a lot of financial challenges, so there are all these things. So we are not relaxing. Then we are also taking on too many responsibilities, and many of us are guilty. You are the HOD, you are the clinician, you're also heading a private facility, you're also the Nyumba Kumi chairman, and you also have a matatu, and so you are the treasurer of the SACCO. You have so many things, and you are being expected to do too many things, and you don't have support relationships. There are no people who can tell you to stop. And that's one of the things we are hoping that we can encourage as we go along, that there's someone who can tell you, eat it, you have not rested. Eat it, you need to eat. Eat it, you need to go for a break. Very, very important. Lack of life work integration, I'm told, is no longer called balance, because there may never be a balance per se, but reminding ourselves we are people who have families, we have other social activities that we can participate in. It's not just work until there's no time to play at all. Then the other thing, we need to recognize that first, for being a student, which is why we went to medical school, most of us will be high achievers, type A personalities, people who want to be everything done perfectly, people who sometimes even have difficulties delegating. And these are some of the things that are contributing to some of us going down, drinking, or getting negative ways of coping, because it's never good enough. And you don't believe anyone else can do as well as you're doing. So very important, but we also recognize there are also people who have, whether from depression or other issues, negative view of self, the other people, and the entire world. And mostly this would have come from childhood or difficult life events. So they're always taking the negative aspects. And in healthcare, there'll always be a child or a mother who has a poor outcome, but they always blame themselves, these ones who have challenges. So very important for us to keep reminding ourselves. So other than burnout, the other thing is compassion fatigue. I'm sure we've seen people who don't care anymore. And you wonder, did they not always care? Why did they even do medicine? But the truth is, if you work in the environment you describe, you actually get a risk of emotional exhaustion, where you no longer are able to care because you cared too much. So it's very important for us to keep recognizing this, especially because you may not fulfill the criteria for depression, but you no longer are able to care. A patient walks in, they ask you a question and you're already irritated at them, and you don't care whether someone gives them a response or not. You are on call and you're called, but you don't care whether someone has PPH and needs to be addressed, or you feel nothing at that point. It's not really just feeling nothing. Most of the time, it's because you got fatigued in terms of your emotion. Then the other very common concept that we need to familiarize ourselves, especially when you work in situations where there are no resources, or you have 2 ICU beds and you are always getting more than 6 patients, you always have to keep making decisions, and you almost like come to witness death because there's nothing that can be done. The concept of moral injury again is affecting us. And vicarious trauma, just listening to a lot of trauma, a lot of stories, it's affecting many of us. And for this reason then, because we are agreeing together that for being human and then for being a doctor, especially in our setting, you are at risk, then what do? We must remind ourselves that first is our business to ensure that we are well as much as is humanly possible. We have been taught ours is to give, never to receive. Ours is to help, but we can't allow ourselves to be vulnerable. And we want the narrative today is we must allow ourselves to be vulnerable because we are human. And we need to embrace a culture of promoting wellness physically and mentally. And the most important thing to remember is mental wellness is as important as physical wellness. If you're going to undress for you and a speculum is done on you, or your private person examine to check whether your prostate is okay, you must also allow yourself to be vulnerable, to have someone listen to your stories that are killing you, that are giving you sleepless night. And we are saying this prioritizing of mental wellness is not going to just be a one very simple solution. I sit here 1.5 hours and come up with a solution. It's going to be complex, it's going to be multifaceted, and we are calling on each one of us to ask themselves, what is your role in ensuring that mental health becomes a priority? And the solutions are going to be at 2 levels, at individual level and at a system level. We are not going to sit here and say serikali's idea, like that lady of Budalangi who used to say serikali itanifanyia nini. The first most important challenge is wewe utajifanyia nini. You as a Kenyan doctor, what are you going to do to ensure your mental health is a priority? Again, there are many things we could discuss. And I know this is a repetition, but please let's keep reminding ourselves, because sometimes we forget. It's dependent on you. Your mental wellness is going to start with you. Are you aware every day what you're feeling? Or you're the kind of person who would be crying, and when you get into public, people ask you, how are you? You say you are okay. Even when you know deep inside you're not okay. Understand your mood, understand what is frustrating you, understand what you're going through, and expand your vocabulary. So that okay is not the only answer that is expected of you when people ask you. Of course, the whole world doesn't care, but there are a few people you should be able to tell, I'm frustrated, I am angry, I'm on edge. The other important thing is self-care. We have said our work, naturally, like, we are expected to continuously work, and it's a sin, quote unquote, to go on leave. But we are saying we have to reclaim our space, and we are going to say it's our business to be well. You're going to eat lunch. I know there's a friend of mine who is a pediatrician, and sometimes I tell her, you have to go to the toilet. You cannot suffer cystitis just because parents are complaining the queue is long. You have to eat, and I'm also guilty of the same. And frequently I have to remind myself that I'm human and I need to eat lunch. Let's eat. It's okay to take a break to eat. It's okay to go to the toilet. Don't get cystitis because the queue is long. It's okay to sleep. Actually, 8 hours. That's what is recommended. Anything else that's causing you not to sleep 8 hours is causing you harm, whether it's social media or it's work. You need to put in effort. Social support systems. We are loners, especially because I don't know whether it's cooler. It gets cooler when you get more money or when you're a doctor, but there's a risk that if you don't actively work on it, it's possible that you have no support system. And sure, especially for the boy child, you know, for girls, somehow even salons and many places tend to give us some form of support, and it's easy to talk. It's okay to have a friend, your peer, especially for senior people. Please remember, have a social support system. Have people who can tell you stop. People who can tell you, I have noted your dressing is changing. Problem solving skills. Again, we are doctors, we can read. Let's appraise ourselves, looking for solutions to our problems so that they're not overwhelming us, and knowing alcohol is not a solution to our problems. And we are talking about writing, so potential options, A, B, C, D, evaluating what works well, and then monitoring and evaluating whether the option you're choosing makes sense. Positive thinking. There are many negative things that are happening in life, in relationships, but sometimes what we encourage is holding on to what is working as you improve on what is not working. Otherwise, you die when you feel like nothing is working. So remain positive. Don't generalize, I'm a failure. You can't have been a failure. And you went to medical school, you must have succeeded in something. So very important. Behavior activation, doing things that build you up, whatever it is that can build you up. And this, we are again emphasizing, may not be alcohol, because it will give you some short illusion of wellness, and you wake up tomorrow and the fight you had with your wife is still remaining, and many other things. System level, again, we say it is individual. We have a lot to do, but at system level, there are many things. And I'm hoping that as we go along, especially for people in leadership, we can have action plan for mental health at the workplace. Very, very important. How is the working environment? How are you doing in terms of ensuring that despite the shortages, despite the lack of supplies, there's a support system that is available? Or is the workplace where you're working the one that is killing people? Are we our brother's keeper? Are you able to notice that your colleague who's been coming on time is no longer coming on time? They are more irritable. They are no longer making their hair. A girl who would do her makeup is no longer doing her makeup. Do you care? And we want to encourage ourselves. We are team. Let us be our brothers keepers. Let's have structures in our system that allows access to care. And I'm hoping with this, we can even work on things like NHIF. I'm sure you've heard the constraints, especially for mental health, and even them reducing even the limit. And we're hoping we can continue working together to ensure people who are affected by mental health issues can easily access specialized mental health care. And once they are treated, they are not stigmatized, they can be reintegrated so that they can continue, not given labels. And with this must come an investment in mental health care, the same way we are investing for other chronic diseases. What are we saying in a nutshell? We are saying we are human, we have a brain, we are at risk of mental health issues, twice more likely than the general population. And it's our business as doctors to prioritize our healthcare system. And for those of us, because I know we are many who are in leadership, to ensure that the systems that are put in place are actually promoting mental wellness. And remember, mental illness is not for a select few people, it's for all of us. And everyone of us has a contribution in making a difference in this field. Let's normalize seeking healthcare from counselors, from psychiatrists. Let's not be in the group of people who say, kuongeleshwa tu. I've heard people saying, yani, I'm paying to be talked to. I want to tell you, they say, for surgeons, they cut. For us, we talk to people. So that is it, and that's therapy. And we need to be humble enough to say, I can talk to a psychologist who can help me. So it's very important. We cannot give health when we don't have health ourselves. You cannot put an oxygen mask on another person when yourself you're collapsing. We need to start by putting on our own oxygen mask. So I'd wish to go on and on, but we have no time, and we need to hear your questions and have discussions. But this is it. The forest is on fire in terms of physician wellness. And some of us have sat and we feel overwhelmed. But I want to challenge us with the words of Wangari Maathai. You must be the hummingbird, but choose to be the hummingbird that says, I don't have all the resources, I don't have everything that should be done to make mental health a global priority, especially for doctors. But you know what? In my setting, as a leader, in my capacity as an individual, I'm going to do whatever it is that I can, including just continuing to learn about mental health, mobilizing for resources so that we can quench this fire of mental and wellness. I pray that all of us will choose to do the best that we can. Thank you very much. Back to you, Dr. Florence.
Thank you. Thank you so much, Dr. Edith, for a very powerful presentation. And thank you for reminding us that mental health is really, it's a personal responsibility. It's a responsibility of our institutions and the government at systems level, but it's also a personal responsibility. And I like what you said about integration, work-life integration. Those two things must happen together. Similarly, mental health must be a part of what you do every day. So self-care is not something that you do occasionally after 1 month of heavy work or after 1 year of heavy work. It's something that must be inbuilt into our daily lives. So thank you so much, Dr. Edith Kwoba, for that presentation. We'll keep the questions to the tail end when we'll have a question and answer session. Right now, we'd like to invite Dr. Frank Njenga to give some remarks and perspectives on this topic. So Dr. Njenga is a fellow emeritus of the Royal College of Psychiatrists. For the last 41 years, he has served in many roles in Kenya and the world. He's a renowned psychiatrist, having trained psychiatry at the world-famous Maudsley Hospital in London. He taught at the University of Nairobi before moving on to private practice in 1983. He's the Presidential Advisor on Mental Health, Republic of Kenya, and he's chairman of the Chiromo Hospital Group. He recently chaired the National Task Force on Mental Health in Kenya. So karibu so much, Dr. Frank Njenga, and give us some insights on that topic. Karibu.
Many thanks, Dr. Jaguga. It's impossible for me to improve on what Edith Kwoba has stated, almost as a matter of course. But this I can say that it's clear to me now that finally doctors matter. Doctors matter because I think it was in Eldoret earlier this year, the Kenya Medical Association asked me to do a paper on physician health. And I titled the presentation, Put on Your Own Masks First, before helping others. The fact that KMA has put up not only this idea that we are important and was able at the general meeting to put together this committee that has convened today's meeting, that has so far attracted 464 attendees, for me is more than adequate evidence that finally we are addressing the real important things as doctors. And for me, the most important thing for ourselves is ourselves. Because, again, as Dr. Quoba has alluded to, a doctor who is not in good physical or mental health is of little or no use of any sort to his patients. Back in Eldoret, 2019, July, Dr. Quoba, you may recall, I was invited by yourself and Professor Atwoli and other people to talk about the self-care for psychiatrists right there in Eldoret. What seems to have happened is that we as psychiatrists were the earliest ones to realize and appreciate our own vulnerability. And we recognize this in different ways. Over the last 4 or 5 years, the senior members of our societies, including Joe Alwach, a former chair of KMA, Dan Giponyo, a classmate of mine who's now an old person, talked to young psychiatrists as soon as they graduated on the subject of physician, heal thyself. And essentially, what these very senior colleagues were telling young psychiatrists was that check on your blood pressure, check on your prostate, check on your, and so on. I remember 3 or 4 years ago in Kisumu, my friend, Dr. Rwegelera from Uganda, made a very, 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 very moving presentation on her own journey with a physical illness that eventually took her life. What am I saying? I am saying that we as doctors are departing from the era in which our heads were firmly buried into the sand and are now declaring that we will do something about this one. When I spoke to the young psychiatrist in 2019, I made the statement that we as doctors are our own worst enemies. And we are our own worst enemies, as I was able to demonstrate at the time, because we often self-medicate. We are often too ashamed or too shy to acknowledge that we are having difficulties with sleep. And typically we start by swallowing a few tablets of diazepam, and other sleeping medication. I have seen doctors put themselves on antidepressant medications. Others have put themselves on antipsychotics, things that you would never allow in any of our patients. As Dr. Quoba has told us, this comes about because our training tells us that there is God at the top, then there are angels, then there are doctors. And the human beings are different because they are weaklings and they are really rubbish. Well, you know what? We are not anywhere near angels. We are normal human beings. We've been told that burnout presents itself as difficulties functioning at our work. But again, I want to emphasize the point that you have made, Dr. Quoba, which is that we then move on to normalize our suffering. We say, we as doctors were born to suffer. We were born to live a life that we cannot put our worst enemies into. Anyway, we have been taught to normalize this. I'll give you a quotation that again I gave some time back of a psychiatrist who recognized her own burnout. Her name is a girl called Claire, who said, as a psychiatrist, I had hoped that I knew a great deal about empathizing with my patients. Finally, I discovered that I did not know how to empathize with myself. And this realization, she continues to say, came about when I heard my own patients whispering about me and talking about me. And this is what the patients were saying about you, the doctor. He seemed more distressed than me. This doctor is so stressed. He doesn't even seem to listen to what I am telling him. Much as we pretend that nobody is watching and nobody is seeing, I can tell you, our patients can tell when you have had a bad night's sleep. Our patients can tell when we are smelling of alcohol from too much consumption the previous day. Our patients can tell when your hands begin to tremble. Our doctors can tell when we are going through a major depressive episode. So, and this is another doctor talking about how she has gone through depression in her own life. And she says, I began to do online depression screening questionnaires, but when I scored high, I dismissed them. These online tests are not good. They are wrong. This she was describing to the doctor who eventually got her out of it. And this is the tragedy. She continues, my colleagues didn't seem to notice. However, as I've said, most of my patients picked the fact that I was not myself. What am I saying? When we look at each other, when we see that we are going down the drain as doctors, we are trained to turn the other way and to say he or she is only going through a difficult day. I could go on and on, but will not do that. My acceptance with some excitement about coming to join this panel tonight is on account of the fact that I am now satisfied that we have said as a brotherhood, as a family, enough is enough. We will put on our own masks first before we help other people, including the patients for whom we have sworn the Hippocratic oath to serve. In fact, I would submit that not looking after ourselves goes against that oath in the sense that it stands in the way of us giving effective and appropriate care to our patients. I don't know if Dr. Koba, you had mentioned the tripartite agreements that were entered between the different parties. But I think I'll let you discuss that, because I think we are now no longer ashamed of the fact that not only can we recognize ourselves as falling ill, but we should also have programs that allow and encourage us to go in the direction of early diagnosis, early intervention, and promotion of wellness. Let me stop there because I can go. I have seen a lot in the time that I have been in this one, and I know all of us, without exception, are normal, ordinary human beings who must be looked after by brother, looking after brother and sister. Many thanks.
Thank you so much, Dr. Njenga, for sharing your perspectives. And I think one thing that I like that you have emphasized is that we are human beings. And you started by saying that doctors perceive themselves as being superhuman, being right beneath the angels. You said God and then angels and then doctors. But that is not true. We are as human as we can get. The same how we are made up mentally, physically, is exactly the same way the general population is made up. So we are exactly the same, and we are vulnerable to the exact same mental and physical conditions that the general population faces. So I think that realization is powerful then, because it makes us seek help. Okay, we see a lot of times physicians and doctors are not seeking help because they cannot accept vulnerability. And I think we've been reminded that over and over again by the initial presenter, Dr. Koba, and now by Frank Njenga as well. Thank you also for emphasizing that self-care is extremely, extremely important. You mentioned at the end that prevention and early diagnosis is extremely important. And it's in the simple things that we do. Self-care is about making sure that you're sleeping well, making sure that you're eating well, making sure that you're not getting into burnout, recognizing burnout early. So these are the very simple things that can be done that don't need heavy budgets, that can be useful for promoting our mental health. I'm seeing a lot of questions already here on the chat. I think we will start by going through them. So feel free either to raise your hand. Mel, are they able to raise their hands and ask a question, or they post on the chat?
They're able to raise their hands.
Okay, and ask a question, or else we can start by looking at what's on the chat already. But before we go to what's on the chat, Dr. Koba, this is to you, and I think Dr. Frank Njenga as well. There was a comment earlier by a colleague about us being our own, enemies, about the work environment being quite toxic in terms of colleagues not interacting well, and this interfering with mental health, or colleagues sabotaging each other and interfering with mental health. I don't know, Dr. Koba, any comments that you'd have about that, and then we can hear thoughts from Dr. Frank Njenga as well.
Thank you, Dr. Florence. But so that this doesn't escape our mind, so I'm going to comment about us being our enemies, but I want to mention something that I had hoped Dr. Njenga would say, but he's just being modest because this relates to him. So in June, Kenya Medical Association, Kenya Psychiatric Association, and Chiromo Hospital Group signed an agreement. And this agreement was, remember we said we need to have a solutions, was for solutions in terms of access to care. As many of you would know, Dr. Njenga is the chairman of the Chiromo Hospital Group, and they have the state-of-art facilities in Nairobi and now in Mombasa. And Dr. Njenga, we met again this after the agreement to support doctors to increase access to care. One, let all doctors note that, especially because it's difficult for you, for example, if you're working in Nairobi, to feel comfortable going to Mathare. We hope we can normalize that, but sometimes you also want some private form of service. And Chiromo Hospital Group offers this kind of service. And if you just go to the website and check, it's a very decent place where you can be taken care of with dignity. And with the current physician wellness committee, we actually met Dr. Njenga with Dr. Melanie here. And Dr. Njenga was very gracious to tell us that while we signed the agreement, he's actually ready to make sure that we implement this practically. And especially for doctors in the coast division, we say that this is going to be the first place. There's a very nice hospital in Nyali. I was telling him someone could just check in to just go and eat the 5-star kind of food in his hospital as he checks, as they share about the challenges they're having. Very nice place in Nyali. And it's good to know that these services are available in terms of your outpatient care, psychotherapy, assessment. And we are encouraging you, if you are afraid of seeking care in Coast General, for example, Chiromo Hospital Group is willing to support you. But I am sure that even if Dr. Njenga has not said this openly, even the Nairobi offices, they are open for all of us as doctors. We are often afraid to go, for example, even in Moi Teaching and Referral Hospital. Sometimes you want to tell the story to someone who doesn't know you, just so that it can be confidential, for example. And Chiromo hospitals are open, they are willing to support you, feel free. And I hope at the end of this, we'll get a phone number and an email address that we can share with all of you on the chat. And you can also access this information through the KMA office and through the Kenya Psychiatric Association office if you need help. We said we must begin to look for our own solutions. And we want to thank Dr. Njenga most sincerely for opening the doors for all of us to be able to seek care. So really, what are we saying? We have no excuse. There's at least a starting point, but we hope going forward, we can also establish many other centers in the country where as a physician, as a doctor, you can actually seek mental health care in a dignified manner without feeling embarrassed, without feeling like everyone will know that you're seeking care. Although eventually, we want to hope that you can all access care, just like you go to see an obstetrician in every place. So I wanted to make that comment. Thank you very much, Dr. Jenga, for that. And we hope that we can get those contacts just on the chat so that we can share. So going back to the colleagues as toxic environments, and we are our own worst enemies. I think, in my view, this is true and very unfortunate, and especially because we have been there, we have worked in shifts, we've seen patients, we know sometimes things don't go right, sometimes people can come late for a very justified reason, but sometimes we don't listen to our colleagues, and that's why we said we need to be our brother's keeper. That person that you're supervising as a head of department, and I've been privileged to be a head of department for like 8 years now. Why are they coming late? Could they be bothered about something? So instead of just being punitive and writing show-cause letters, some of us are fans of just writing letters as if it validates you when you have the most number of show-cause letters or when you make people's life difficult. Instead of doing that, check with them. Is there something that is bothering them? Why is it that they come late many times? Is it that they are struggling? Is it that they're not sleeping? Why are they drinking? Could they be drinking to cope with depression, for example? And I'm not saying we should not be firm, but we are saying we should go out of our way, especially as leaders, to ask. Because I was taught by Professor Ndete very early on that there's a reason why people behave how they behave. Are they just bad people? I'm one person who is convinced that many people have good intentions, but they go through things that define them. Let's be the ones to support. And by asking that question, you may not be the psychiatrist or the psychologist. Tell them we can provide an opportunity for you to talk to another person. So let's be the people to help. And like in Moi Teaching and Referral Hospital, we have what we call the employee assisted program, where we have many providers who can actually help this person, because some people may not be comfortable with you as a med soup or the CEO, but let's be the ones to recognize and send people to care. You can't be their doctor most of the time because you have the management position, but you can link them to someone else to help them. So yes, we are our enemies, but we are hoping that with this discussion, we are going to be each other's, our brother's keeper. We are going to help. Work schedule, honestly, I think it's very unfortunate that you would harass people because they went for lunch. And we said we must not apologize for being human beings. I saw that on a wall, and I was very impressed by some discussion around that. Doctors are human. Doctors have children who have sports day. Doctors have to take their children to school. You can't be the leader who says you can't go take your child to school, or you can't go check on your child who is sick. And we can't expect this mother whose house girl left to carry the child on the back. So I think we need to remember that the people we are supervising are us, but also reverse it and ask ourselves, if you are the same person in the shoes of the person who is below you, how would you like to be treated? The golden rule, treat them as such.
Thank you so much.
Florence.
Yeah, thank you so much, Dr. Koba. I'd like to hear insights from Dr. Njenga as well, because this is a recurring theme throughout the chats and the QA section. I'm seeing people asking about this particular issue. So any thoughts on how we can be each other's keeper, Dr. Njenga?
Yes, I think I would say nothing more from beyond that on agreements made by those three parties. But I would like to emphasize something slightly different. I would like to emphasize the idea of promotion and prevention, because when we are in medical school, we are taught a lot about diseases, and we are not often told about how we promote, even for our patients, their health and well-being. And I would like to emphasize that we owe it to ourselves to do basic things that are promotive of our mental health being. And I think this, again, is what the Kenya Psychiatric Association, with other partners, is able to do for members of the Kenya Medical Association. For example, in this webinar, I think we have emphasized adequately that this denial culture that we have, that says effectively that we are not like our patients, will start being eaten away. And I think the 524 people who are here present, whether we like it or not, we are here because we know that it is possible. There are basic things that we can do for ourselves as doctors that help in the promotion of our well-being. For example, just Google, if you like, the concept of sleep hygiene and what sleep hygiene means. The concept of sleep hygiene and the way it promotes our well-being is completely the opposite of what we are trained as interns and as medical officers and as young doctors. They emphasize that sleep is for lazy people. Sleep is not important. Regular sleep, we know from all the science that we mental health experts know about, is that regular sleep for adequate length of time is a first aid measure to ensure that you are mentally well. We are told about exercise and diabetes and hypertension, but no, people forget to tell you that physical exercise of any form is one of the most important interventions in the management of mild and moderate depression, for example. And our nutrition as well. We've been told about alcohol and the way these things go. I don't think we have emphasized enough previously the importance of supportive relationships. The science around loneliness and mental health needs and mortality as well is not spoken enough to groups such as this one. But again, we know that those people who are lonely, those who perceive themselves as being lonely, have a shorter life expectancy. And some people argue that even conditions like dementia of all sorts are more likely to occur in people, particularly older people like myself. Edith, you've told us, and I have no apology about repeating this, about the boundaries that doctors must create. Nobody tells young doctors that really there is a time to say, I am now a mother, I am now a father, I'm now a son, I'm now a daughter. I am not going to take this call because I need to attend to my family. These things don't come to us naturally because our seniors and our colleagues don't tell us these things. Related to that is the whole concept of time away from work. Again, our training from internship, medical officer, is that you live to cure people. You live to make sure that yourself, you die and others live. Now, that is no longer the way we want to live. And I think we need to teach ourselves things like this. You know, the Kenyan psychiatrists were in Mombasa last week, top secret, and we discussed hobbies and we talked about the importance. Anybody can get into a hobby. It doesn't have to be tennis or golf or football or swimming. It's something that distracts your mind away from work and enables you to charge and recharge. I have only two other things that I will say, because again, I could go on. We are not allowed, so to speak, to discuss the importance of interpersonal relationships or methods of nurturing relationships between our spouses, between our brothers and sisters, between our parents, as though these things don't matter. These are the things that promote good mental health, and yet we don't talk about them enough. And then finally, there is the whole idea of mindfulness as a concept. What am I saying? I'm saying that much as there are tripartite agreements that will help us deal with this thing. There are almost first aid things that are available easily in your locality that, taken together with everything else, can be promotive. Curative services are very, 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 very important. But for me, curative services come into play after we have put in place the preventive and promotional activities. Back to you, Dr. Yabuga.
Thank you so much, Dr. Njenga, for emphasizing the need for self-care and for promoting mental health. In any case, WHO says the bulk of mental health services, the huge bulk, should be those simple things that we do to promote mental health, like exercising, eating well, mindfulness, and so on and so forth, and less of the curative care. That should really be the tip of the iceberg, but the bulk of the efforts should be towards promoting mental health. And there's an interesting comment here that I'll ask you, Dr. Frank Njenga, to address. Someone says self-care is all well and good, but it's also important to remember that when one's mental health is compromised, it also compromises the ability to make these decisions about self-care. So this person proposes that rather than saying seek help, we should be making an effort to integrate help-seeking systems within the healthcare for doctors. For example, they are proposing, do we have debriefing sessions built into our regular, care as part of what happens within our health institutions? So I'm happy to hear any thoughts about that from Dr. Njenga, and we'll also hear from Dr. Kwoba as well. How can health institutions be proactive in promoting the mental health of healthcare workers?
The irony, of course, of today's conversation, that unless I am wrong, this is a first, where a whole Kenya Medical Association fraternity has decided to look at itself and look for ways of assisting its members to promote their mental well-being. To my knowledge, there are not yet formal systems over and beyond the employee assistance programs that Dr. Kwoba was talking about. But I see a webinar such as this one. I see the wellness, mental wellness committee, where Melanie and Dr. Kwoba are members, being the embryonic forms of what the future will look like. And I think part of the reason we're here today is to hear from members of KMA how they would like to customize the way forward, having accepted for the first time that we are not angels, but are human beings. But I think I know I'm a member of KMA and a very, very long-standing member of KMA. I have to say I stand proud of KMA for the bold decision it has taken to look after its members in the way that it has now done. I'm a proud member of KMA in that regard.
Thank you so much, Dr. Kwoba. How can health institutions be proactive in taking care of the workers?
Thank you, Florence. I think I want to return it to the person who asked. How is that person going to contribute to having even a support group within their own system? I wish Moi Teaching and Referral Hospital would do something, your hospital, Kajiado County Hospital would, but I also want to challenge us. Sometimes it starts with you in your department, having just a few team members and saying, we will meet every Thursday morning to have a cup of tea in the provided maybe tea room and check how we are doing. I think we don't want to have the Serikali's idea mentality. It's going to take a long time. And I'm not saying Serikali won't do anything, but I want you as an individual to make sure you have a support system within your department. But then I also hope, because I believe they are managers of hospital, to ask themselves, what can they do? And that's why I talked about the mental health action plan for each institution. So we start as an individual, we go to departments, and then as we go to the county level, for example, what is the county doing to ensure that its healthcare providers, its doctors are well taken care of, and then the government. And that's why we talked about mental health investment. So it's not just the solution of one person. It's you and your people. Please start with your small teams. But there's something, Doc, I wanted to just comment on about us being family members so that we don't mistake that with people who are also, there's also some mediocrity. So we are mothers, we are fathers, we are siblings, we have children, but let not that be the reason we don't work, because I think we also need a balance, and that's causing conflict with us and our bosses. So that's there's someone whose house girl goes away every time. There's someone whose sister is always being operated. There's someone whose child has to be visited every time. So we need to have a balance so that you're not crying wolf, because it's going to be difficult for us to know when you have trouble. Because there's someone who was commenting about the bosses providing toxic environments and giving show cause letters, but we need to balance so that at the end of the day, it's genuine, but it's genuine, you need to go. But again, your car must not have a puncture every time, so that we also not excusing mediocrity while saying that now we are allowing ourselves to be human. That's the one thing when Dr. Jenga was talking that came to my mind.
Thank you so much, Dr. Edith, for telling us that it is everyone's business. You see, remember when you're pointing one finger out, the other four are pointing right back at you. So I have a responsibility as Florence to take care of my own mental health. I have a responsibility to initiate mental health programs within the space that I work in, okay? So we all have a role to play, and we should be proactive in making sure we are promoting mental health in the different settings that we have. You know, a lot of times we think there is this mighty power or this big government that's going to come and that's going to change things around. But I think it's important to realize that change starts with me in these very small ways. It mustn't be an extremely, you know, very big, very elaborate way. Even the small steps do matter. I'm seeing Dr. Violet Koech has her hand up and she would like to make a comment. Dr. Violet, please unmute yourself and make a comment.
Dr. Jaguga, we may need her to be invited as a panelist, but and how Peter Kemi has had that. Maybe we can be going on as that happens. It doesn't happen in a short time.
Okay, so I think we'll.
Okay, hi.
You've been able to unmute, Dr. Violet?
I think so. Can you hear me? This is Dr. Okech.
Yes, yes. Please go ahead.
Yeah, this is, thank you so much. Sorry, I joined in a bit late. This is a very, very timely and wonderful webinar because the mental health of doctors is so important. I wanted to bring to your attention and to applaud Chiromo Group Hospital and Dr. Frank Jenga for partnering with our department of, I'm a consultant psychiatrist at the Department of Mental Health KNH, and I chair adult psychiatry. So 2 years ago, I asked Dr. Njenga whether they could assist us in providing a psychological support to medical students and doctors in training, or doctors who are medical officers who have any mental health issues or need psychosocial support. And he very, very graciously agreed. And we've actually had almost about 40 doctors and medical students passing through our hands in the last 2 years. And we see them, well, I see them at my clinic at KNH, and then they are sent, they're giving a number of sessions with the psychologists at Chiromo Group of Hospital. I can say that because of that service, we have saved a number of lives. I'm glad that, you know, there's a wellness committee and all from KMA. I'd love to join that group. It's just that I'm not paid up yet, so I need to renew my membership for KMA and join back in. I also want to give a personal experience as a doctor who has lived with a number of chronic illnesses and also lived the experience of depression, that I have been able to go thus far in my career because of the support and understanding that I've had from my colleagues, both at KNH and even at KMA. My inspiration to be a psychiatrist actually came from Dr. Frank Jenga, who really took hold of my hand and mentored me when I was a young psychiatrist. And even when he sent me to the Young Psychiatrist Council, I was in much better health then, and I was able to do a lot for the country. And now I find that as I'm nearing retirement, I'm at the stage of, I think this is really a wonderful thing that doctors are realizing that we are human beings like anyone else, and let us be kind to one another. For me, I can say that, you know, Dr. Njenga, Dr. Kigama, Dr. Makanyengo, and the doctors that I work with, Professor Mathai, Dr. Omondi, Dr. Kanyanya, Dr. Mareko, whom I've worked with at KNH, they have been of great support to me, and they have allowed me to be able to work at my pace on the days that my body is not so well. And I've been able to get good care from my, you know, one of the senior psychiatrists who sees me. And because of that, I'm able to do my life. And because of that, I'm also reaching out to other doctors and saying that it's okay not to be okay. And I thank God that we are having this conversation. It's very, very important. And I really, I'm so thrilled to hear that KMA, KPA, and Chiromo Group have something. So I'm looking forward to, if there's still space on the committee, I'd love to join in. And as I tell doctors, I'm happy to listen to you. And actually, when doctors come and doctors in training come to rotate with us, we tell them that we have a listening ear in case you have a personal issue or something that is disturbing you. We are here for you. And because of that, it has made a difference. Thank you.
Thank you so much, Violet, for sharing your own lived experience. And sharing like this really helps to break stigma. We saw earlier on that stigma is a very big barrier to seeking help for the general population, but also for doctors as well. So having you talk about your own personal experiences, your own personal experience is a good thing, and we do appreciate. I see some comments here from the young doctors. I see one recurrent theme here about young medical officers and interns who are struggling to look for jobs and struggling to make ends meet. And they're saying that is traumatic for them and devastating. And they're wondering how senior doctors in positions of power can help advocate for them and support them. I think I'll pass this question to Dr. Frank Njenga. How do we support the junior doctors who are struggling?
I do not have the answer to this very, 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 very difficult question. And I can say, however, that the fate of our younger colleagues in particular lies mostly in the hands of those people who are responsible for the management of our government. I shouldn't say this, but when many of us here qualified, we were assured and guaranteed jobs, and the only place we knew where doctors didn't have jobs, we were told, was in India. How we got to this place, I am not 100% sure, but I suspect that the way we have managed the healthcare system in this country, particularly in relation to devolution, may have some answers to give us. I remember that while this 2010 constitution was under discussion and negotiation, there was a concept, I think fronted mostly by Kamarogo and Nikao and myself, among other people, to the effect of having a national health commission to look at all matters of training, deployment, and so on. And I think to the extent that we can, as a group, as KMA, this is work that is yet to be done. We have a new government, and I think we need to keep pressing this idea that we as doctors are entitled to a commission with powers and responsibilities at a national level to look into our affairs. I don't see an immediate or easy answer, but I think in the medium and long term, working together. But as I say, I don't know that anybody has the full or definitive answer to this most difficult of questions.
Thank you, Dr. Njenga. To Dr. Koba, what can we do to support the young medical officers and the interns who are going through a very distressing time and struggling to make ends meet? What can the KMA Wellness Committee do to support?
In addition to just having these webinars, I know like today I sent a lot of young doctors with this message so that they can join us. The other thing that maybe we need to think about as a community is if you are very many, we've said some of us who have like 6 jobs, And some of those jobs could be delegated, but that means that you'd get less money. If we can accept that maybe we need to share the cake, because there are some of us who are doing work that can be done by younger doctors, yet we have other jobs. You are a senior consultant, you are doing locums and even seeing general patients out there. Is it possible for us to continuously encourage ourselves to share this cake, especially because it's good for your mental health? It's good for your physical health, but it also provides another person. But that's continuous. And I don't know that even if we did that, we stopped, like if you stop private practice altogether and allowed the doctors, the unemployed doctors to take up the positions, will we take all of them? I'm not sure, but I think KMA, KMPDU and all of us also, because we know people, we continue lobbying for more employment, because this is the truth. I don't think we are flooded in Kenya in terms of doctors. If you look at the doctor-patient ratio, in the counties, we don't have enough. So I think it's our continuous business, even as a KMA, to lobby. Someone was mentioning on the charts whether we can stop working extra hours, because some of us are dying and the county feels because we are compensating for their shortages, then they don't need to hire. That's the other thing. But the other very, very important thing, I feel like we also as doctors at a point where we must salvage our profession, because if and it's not true what was in the media for a long time that we don't work. There are many very hardworking doctors, but unfortunately, when for some of us you don't work enough, counties feel like they had rather hire other people. So we are also failing ourselves. So we need to make sure that we don't appear like we are dispensable. So we must avail ourselves to do what we must do, but again, not encourage ourselves to do so much that we take a job for 3 people. So those are some of the things. I don't know whether they'll be put in policy. And like Dr. Jenga said, there's no one solution, but let's continue thinking about this, how to keep supporting, to keep lobbying. And when you can allow a younger person to do the job, please do. At the end of the day, you can only drive one car, live in one house. Maybe you don't need too much when a person is sleeping hungry.
Thank you so much, Dr. Edith. I see time is running out. There's one hand up by Virginia Minor. Virginia, quickly, and that should be the last question for the day. Virginia, please unmute.
Dr. Florence, I don't know whether you looked at the Q&A specifically other than the chats.
Yes, I did.
Okay. So.
Is there something you'd like to address, Doc? Any particular thing I may have missed out? I tried to summarize.
No, I think it's okay. If you look at it, it's good.
Okay.
As we hope Virginia has been invited.
Yeah. Virginia Minor, please go ahead.
I think the only thing as maybe they go ahead is I see there's a question of the seniors being mean. I think we need to remind ourselves we are a brother's keeper. Imagine if that was your son. You know, I keep saying my daughter will be a doctor, hopefully. If I'm treating an intern meanly, does that mean that it's okay for my daughter to be treated badly? We have had consultants who call people names. Of course, we are not encouraging mediocrity. We are not encouraging laziness, but I want to remind ourselves the golden rule. If your daughter became a doctor, you senior consultant, how you have insulted that person, because that's also someone's daughter. Would you like that to happen? I think we need to encourage ourselves. I think in psychiatry, we have been very lucky because I have never been insulted in mental health. We sit together with very senior people, including Dr. Frank Jenga and Professor Ndetei. I remember Professor Ndetei used to serve as tea. It never reduced their positions. You don't have to insult anyone or to demean them to be respectable. And I think for me, that's what we want to encourage ourselves. Just treat the other person as you would wish your daughter or yourself to be treated.
Okay, thank you. Thank you so much, Dr. Koba. Would you like to say your parting shot, or that was it? Would you like to say your parting shot?
I think for me is to remind us, truly we are human, help is available, and everyone has their role. It's really just a reminder. It's okay to be helpless and vulnerable. You don't always have to be the strong person who is always providing care. And if you can undress to be examined by an obstetrician or a urologist, I believe if you think it's very embarrassing to talk about those relationships probably at the same level, but it is life-saving. And yes, it's only talking, but that talking is what you might require. I remember, unfortunately, one consultant who said they can't talk to me because I was very young. Unfortunately, they are many feet under It was alcohol related. I'm very young. I've lost 4 doctors already, despite being this young, to alcohol use disorder. It hurts me that we are losing people because we have assumed that mental health is not an issue. Please, let's seek help. Please, let's support each other so that we don't lose one more life to a mental health related issue.
Thank you so much, Dr. Edith. Dr. Frank Njenga, your parting shot.
We're on the right track. I'm happy and I'm proud to be a member of Kenya Medical Association. I'm happy to be proud member of the Kenya Psychiatric Association. Some will say that this conversation is coming too late. I don't agree. I think everything in life has its own time and timing. The fact that we have this committee in Kenya Medical Association is a sign that all the battles we have fought in many different trenches in the last almost 40, 50 years are bearing fruit. And we are spending an evening talking about ourselves. Before now, and I can say this for the 45 years plus that I've been a member of KMA, it's always been about them, about patients, never ever about ourselves. Now that the conversation has turned to us, I am full of hope, and I would like us to congratulate ourselves for having arrived at this point. All is not lost, and the future for our mental health, and by extension, that of the people we look after, is good. I'm a happy man.
Thank you so much, Dr. Frank Njenga, Dr. Edith Kwoba, for very excellent presentations and for a very timely discussion. I hand it back to Dr. Melanie to take us through the next session.
Thank you very much, our moderator, Dr. Florence, and thank you very much to our presenters, Dr. Kwoba and Dr. Njenga. This evening, I am a very proud convener. First of all, because of how impactful these presentations have been, the engagement that we have from each one of you. At the moment, we have 480 participants still tuned on, and this encourages me because it shows the interest, and this means we have a lot to do. I can see there's so much question that everybody has, and what I would just like to give as a parting shot is, for number one, we all know now that the Kenya Medical Association Physician Wellbeing Committee exists. For those of you who didn't know, we work very closely with all the other committees within the Kenya Medical Association, as well as the Kenya Psychiatric Association and any other relevant stakeholders. We welcome all of you on board to join the Kenya Medical Association. If you have not joined, if you have not renewed your membership, kindly renew. Join any of the committees, but more importantly, you can also still join our Physician Wellbeing Committee. This evening, we've been reminded one important thing: you cannot pour from an empty cup. A doctor who is sick, mentally unwell or physically unwell, is not of use to the general population. So let's take care of ourselves. This will be just one of the many activities that this Physician Wellbeing Committee will be engaged on. We'll be doing frequent webinars, but we'll also be doing on-the-ground activities, and we look forward to carrying out more and actualizing the tripartite agreement that we already have, of which we'll be sharing details as time comes by. So to finish this presentation this evening, I would like to welcome our Kenya Medical Association President to just give a few remarks regarding the webinar as well as this important day, and then we'll close from there. Thank you.
Yeah, thank you, Melanie, for the presentation. Before I close, I would like the president of the Kenya Dental Association to make a word. I wanted Peter to allow him to speak for 1 minute, and then we can close the program. Peter, allow Tim, he has raised his hand. Melanie, you can allow him.
Yeah, I think I'm on Kigudu.
Okay.
All right.
Yeah, thank you. My name is Dr. Tim Theuri. I'm the president of Kenya Dental Association, and I'm really happy to be here today. The topic of discussion today has been a background discussion that I've been having with Simon and other associations as well as the council, that's KMPDC. And in the course of dispensing the things, the duty that we do have, I've encountered doctors who, of course, are in need of this kind of services. And there are very many situations where you find that even within ourselves that we are lost in terms of seeking help and finding assistance for these doctors. And I'm really happy that this is coming out now and at this pace. What I'd like to encourage is let us open it up and not silo it just to within one cadre. And I commit to bringing Kenya Dental Association on board, talking to our counterparts at PSK, that's the pharmacists, so that we can domicile this initiative within one committee, if I may put it that way, perhaps a joint committee. And from this, we'll be able to have a directed effort and impact within the sector, because from our side, research shows that a huge number of dental surgeons have some form of stress disorder, others mild depressive episodes, and where to get this help is what we are usually very shy about and not open about. I'm particularly very passionate about mental health and wellness in men, and even in informal discussions, we are able to pick out very interesting things. And to Daktari Njenga here, thank you for the effort, and we'll be reaching out just to consolidate these efforts, KMA, ourselves, and PSK, and we hope we can make it a one-stop shop for all our healthcare workers and doctors more so. Thank you, Simon, for the effort. Let's keep the conversation going. Asanteni.
Thank you very much to everyone who has participated in this webinar. We have recently come from the World Medical Association General Assembly meeting, and the WMA, in the latest revision of the Hippocratic Oath, so to speak, have added an order that physicians must take care of their health first. And in the new oathing, that is a line that has been added. So as we continue with this, let us ensure that we take care of our health. And for Kenya Medical Association, one of the resolutions we take from this meeting is that we will continue to pursue the Health Service Commission as one of the ways of preventing mental health disorders and sort of suicide prevention, and ensure that we keep the government on toes to provide both employment and a suitable environment for everyone to be employed. With that, I want to thank all of you. I would urge all of you to pay up your membership so that we can continue with doing the work that the association does, and join the Physician Healthcare Committee. Thank you very much, and have a lovely day.
Thank you, Mr. President. With that closing remarks, I think we've come to the end of our webinar. This will be shared later on for the recording, and your CPD points will be sent to you in the course of the week. Have a good night, take care of your mental health, and please look out for KMA activities. Good night.
Thank you. Bye-bye.